Hi, everyone. I'm Sherry Jordan. I'm the CEO for the Edmond Chamber. I want to thank you guys for joining us today. We're so happy to be able to host this video conference. So just a few housekeeping items. Make sure that you keep yourself on mute so that we won't have any background noise. If you have any questions that you would like for us to try and get to at the end, please put them in the chat feature. And my trusty staff are keeping an eye on those, and we will try and get to those at the end. And then also, if you do experience any kind of technical problems, one thing you can do is if you do have your video on and you have technical problems, shut your video off and see if that helps. We do want to see as many faces as we can, but if you have problems, try that first. So we are so thankful to have Congresswoman Kendra Horn with us today. She has been so busy on many calls, and we have her with us, and that's just so exciting. So Congresswoman Horn represents the 5th Congressional District, and coincidentally, she is also a 5th generation Oklahoman, so that makes it easy for me to remember. She serves on many important committees, including the House Armed Services Committee and the Science, Space and Technology Committee. She is also the chair of the Subcommittee on Space and Aeronautics. So she is in her first term, and she has been working really hard. And one of the things she worked on most recently was she introduced a Too Small to Fail Act with 0% interest loans and $15,000 in immediate grants to small businesses. So I am just going to turn it over to her. She can give us an update on everything that's happening and hopefully talk about her new act that she has just introduced. So without anything further, please help me welcome Congresswoman Kendra Horn.
All right, helps if I unmute myself. Sherry, thank you so much for the invitation, and thanks to everybody that's joining us today. I know that just before everything kind of went in many different directions as the COVID-19 crisis really got into this emergent phase, we were supposed to have a happy hour with some young professionals, so hopefully we'll be able to do that again soon when we can actually be in the same place. But I'm incredibly glad to be here with you all today. What I thought I would do, I'll tell you a little bit about the Too Small to Fail Act, but also give some context around what we've done so far. I think what the programs that probably will be of interest to many of you, some of the wins that we were able to get into the packages, and then looking forward, and I'll look forward to answering questions. I want to let you know that I've got a couple of my staff here on the call who may be able to assist if there are specific details and things that I don't know, or for follow-up, because we've still got a lot of opportunities. And that's Candace Howell, you'll see on here. And also, I think Charlie Chamness doesn't look like his video is on, but is on here as well to be able to help. So let me step back and give some context because I think there have been so many things happening, and the rate of information that has just been moving through, and the impacts on our businesses, on our communities, on healthcare, on our families has just been sweeping through in a way that it's almost hard to catch our breath and see where things are. And so in that, I know there's a lot of questions about what this means for our businesses, what it means for healthcare, and what we've done, and how the programs and the new policies that we've passed out of Congress are going to be impacting many of you. So the first piece that bill that we passed was about a month ago, was $8.3 billion. It was just focused on healthcare. It's when the serious nature and the rapid spread of COVID-19 really began to come up a little bit more. That went to research for vaccines and treatment and money for public health officials at the state and local levels, as well as some other funding related directly to getting healthcare resources where they need to be, PPE, other things like that, which we know those are still ongoing challenges. So acknowledging some of these things are starting to make progress, and others, there's still a lot of challenge. The next package that we passed a few weeks ago was called the Families First Coronavirus Response Act, and that was just over 3 weeks ago. So I think of it in chunks. So with this emergency health related, and then emergency response in the Families First, and then relief in the CARES Act. So kind of building it up. So the Families First Act included things like an expansion of food benefits for our most vulnerable populations, our seniors, expansion of support for families that are right on the edge of the WIC programs, the SNAP programs for families that already might be losing their jobs, are already right on the edge, and the impact to the schools and the kids that are already dependent on those school breakfast and lunch programs. It included paid sick leave and some paid family leave provisions for businesses that would be reimbursed for if they had employees that needed to take time off. The sick leave provisions, 2 weeks of paid sick leave that would apply to an individual who was diagnosed with COVID or who had to take care of a family member who was diagnosed, or even if they weren't diagnosed, who was instructed by a doctor to self-quarantine because of potential exposure, something that I can speak to from personal experience. And as well as some paid family leave provisions, another 2 weeks that would be reimbursed at 2/3 reimbursed or tax credit. There's a few different ways that could come into play. So I'll just say that wouldn't be a top line out of pocket expense for small businesses. Maybe that's a better way to say that there would be some reimbursement of those costs to the businesses. And then another chunk that would be paid parental leave, because as I don't have to tell any of you, I'm sure there are a lot of kids that are home right now, and because our school buildings are closed down, but the needs for education still continue, and that's impacting families in a number of ways. There were other provisions in that bill, including some additional funding for testing, coverage for uninsured individuals to get tested if they needed to without any out-of-pocket expenses on their part, and some other things. Now, the third package was the CARES Act, which we just passed just a week ago. And throughout this conversation, I want to say that there were a lot of discussions going on about how we take care of this, what we do. The Families First package had also some expansion of unemployment benefits, but we recognized that wasn't going to be enough. But to Sherry's point about the bill that I introduced with a couple of my colleagues, the Too Small to Fail Act, when we started these conversations, I was advocating and pushing for relief for our small and mid-sized businesses, the businesses that really make up the backbone of Oklahoma and of so many other places, and that's 500 and under employees as a general definition, of course. And these are the many of you, so many businesses that have been forced to close their doors because of this virus, but at the same time, it was through no fault of your own. So the goal being, with the Too Small to Fail Act and with some of the provisions we were able to get in. Now, all of these bills have been bipartisan. So that means that we've had compromise. There have been some things that are really helpful in there, things that are good. And there were things that we didn't get in that we wanted to, and we're not finished yet. But in the CARES Act, so the Too Small to Fail, we included $15,000 emergency grants, which should have a 3-day turnaround for small businesses to help with that immediate cash flow needs, as well as forgivable loans and grants for small businesses to help maintain their payroll, to basically make it through this time that we're dealing with, this unprecedented time, without having to lose their business, lose all of their employees, and with the intent to hopefully take some of the pressure off of the unemployment. So we had to tackle it in a number of ways. In the CARES Act, the small business portion of the CARES Act includes $350 billion in funding for small businesses. Now, the EIDL, the Economic Injury Disaster Loans Program, was an SBA program that was there already. There are some additional provisions in the CARES Act that expand opportunities for EIDL loans to go from what were about 3.75% interest down to 0%. But there's also the PPP program that was included, which is the Paycheck Protection Program, which has some of the elements of what we did in the Too Small to Fail Act, but is specifically targeted at helping our small businesses to get the funding they need to keep their workforce intact, to make it through this challenging time. and that has $350 billion in funding, and it includes up to $10 million per business, and it depends on your payroll. So businesses are eligible to get up to 250% of their payroll. It's measured by how many employees you had between February 15th and June 30th. Now, I've had questions from businesses about, I had to lay off some employees before we knew that this was coming. Am I disqualified? I want to say, don't disqualify yourselves. There are lots of opportunities, and even if businesses have had to lay off workforce, there's the opportunity to rehire, and that will allow the PPP loans to become grants. So the goal is not for you to add to your balance sheet of debts, but to get cash, to get money to help through this transition, and to help you, to help your employees, to help make it through until we can get onto the other side of this. We've been working closely with the SBA. We've been working closely with our colleagues on the implementation of this. And we're going to have a webinar together with the SBA next Monday evening from 5 to 7. Anyone can register for it. Charlie or Candace, can you put the registration link in the chat box for everybody? And in that, we're going to walk you through the different programs, what people are eligible for, and how to navigate it. One of the good things that we were able to include, because after talking to a number of businesses, as well as a number of lenders, local lenders, one of the challenges with the EIDL program, the Economic Injury Disaster Loan Program, is it was all going through the SBA. And that meant that we're hitting these choke points, and it was slowing down the process. So the PPP program allows businesses to use 7A lenders, so to use SBA approved lenders. It's 100% backed by the SBA, but the ability to use your local bank, if it's a 7A lender, should help expedite the process as well. And there's some expansions about who can also get qualification as a lender in this program. The bill also included critical expansion of some unemployment benefits that include part-time and gig workers, and as well as self-employed people that aren't traditionally covered under unemployment insurance, and an expansion of up to $600 a week federal unemployment for up to 4 months. So we're really trying to cover the various bases here. There's also additional funding for state and local governments. That's one thing that that we were very concerned about, fought hard to make sure that we got in there, as well as support for certain industries that have been dramatically impacted, with some great oversight that also helped to focus on how do we support businesses, but make sure that the funds are also going to help the workforce, so that we're balancing that out, as well as some additional funding for critical PPE and other things like that. So the long and the short of this is there are more impacts than even we know about right now. So in these packages, my goal and our goal has been to just address the needs, healthcare, and to begin to address the economic needs currently that we know, and then moving forward into the future. I anticipate we are going to have a fourth package. There's been a lot of back and forth about that, but when I get asked about it, one of the things that I think is the most important is, one, we have to make sure that all of this is implemented, that these programs are getting implemented. You may have seen in the news the past couple of days the direct economic assistance payments that will go to about 125 million Americans. The intent, and when we put in the provision, was that seniors on Social Security or disabled vets, those on disability that don't have to file taxes because of their income bracket, but they're say a senior on Social Security, wouldn't have to go back and take any additional action to get those payments. The IRS had a different interpretation a few days ago. We pushed back pretty strongly, saying we've got to get this relief out into our communities as quickly as possible, and they changed their guidance yesterday. We've also been really working to push the SBA to get their guidance and their processes in place, and they are ramping up and ready to go. And we've been digging into all of the provisions, and and anybody that has specific questions about their business, we're here to help. But the bottom line is don't predetermine that you're disqualified. I've heard a lot of businesses say, oh, I don't think I'll qualify, so I'm not even going to bother. The moral of the story is you probably will. We'll help you figure out what's the best path for you, because that's why these programs are there. We want to get it out into the communities. And as for timing and what's next, that's hard to say. I mean, it's hard to say how long we're going to have to operate under these shelter in place. We've got to be able to flatten the curve. I've been working really closely with our hospitals, our healthcare providers, public health officials to do everything we can to get the resources into our communities, which has had a number of challenges that we could go into. But the bottom line is we've got to continue plugging these holes and getting the resources where they need to be, so that when we begin to transition out of this, that there's a pathway or a ramp towards getting back to a little bit more productivity, some sense of normalcy. We know that all of that is just incredibly disrupted right now. But that's the point. And in this next package, I am fighting for a few things. I'm fighting for additional targeted relief that will address the critical needs created by this COVID-19 health pandemic and resulting economic crisis related to this crisis and targeted to the needs of this crisis. Some of the things, including like broadband access, some of our children in communities across the 5th District don't have any access to online learning. So they're getting left behind. So how do we get those kind of resources in? Utilities, things like that are impacting our municipalities that are already operating on a razor's thin margin because they operate in Oklahoma using only sales tax. Fixing other problems where we've identified that there was a hole or it didn't exactly address the issue, and then really looking at targeted relief moving forward. But I've also been pressing my colleagues and leadership to say this absolutely has to be a bipartisan package. We need the text earlier in the process. We've got to make sure we're being smart and targeted because we don't know the full extent of the impact. So we've got to continue to focus this next package on finding the relief and getting it to the communities that need it. And then down the road, looking at what's next. But we've got to do this in a stair-step way that ensures implementation and oversight and effective use of all of these taxpayer dollars because that's what's going to ultimately make a difference in the long run. So I will stop there, and I'd be happy to answer any questions.
One question that we had come in actually via email before the meeting earlier today was a question about the vaccine that's being tested and some sort of ways to manufacture it faster even before the testing's done. Do you have any updates on that? The thing about vaccines is they take some time to develop. Now we're clearly speeding up the process, and there are some encouraging signs, but I think we're still looking at a year to 18 months before a vaccine is developed. I think there's a possibility that in the intervening time, there might be some potential treatments that would help mitigate the severity of the symptoms. But one of the challenges in developing a vaccine is that if a vaccine isn't if the vaccine isn't tested and proven out, it can cause other problems, and so they've got to go through this process. So I think the focus has been on increasing the rate of testing, identifying spread, because right now there's still nowhere in the country that just anyone that wants to get tested can get tested, that the testing is only going to people who are exhibiting symptoms, first responders, those who have known exposures to COVID-19. And so I think the vaccine they're making progress, but it's going to be at least another year because they have to get that through the process. There may be some treatments. There are some promising things that are moving for treatments. But in the near term, I think it's from all of the public health experts and everyone that I've talked to, right now the key is to be able to trace it and identify how many people
who have contracted COVID-19 are asymptomatic, who aren't exhibiting symptoms, because the more we're learning about this, the more it appears that there is a sizable percentage of individuals who contract this virus who don't exhibit symptoms but can pass it on. And this long lead time between when somebody can contract and somebody might begin exhibiting symptoms is what makes this so dangerous. So it's going to be in a few different buckets, but I think the quickest movement that we've seen is on the evolution of testing, which is a good sign. And even then, the administration's estimates are that it will be this summer, it will be June or July before we can have really widespread testing, that rapid test, like you go into your doctor's office to get a strep test or a flu test or anything like that. We're making, there's a lot of progress. There's Abbott Labs. There's some companies that have been able to show that there's the rapid testing machines that many doctors' offices have that are beginning to prove that they can test for this. It hasn't completely made it through that process yet, but it's moving pretty quickly, and I think we'll see those kind of movements by this summer, hopefully.
Excellent. Another question we had sent in was, do you know if there's going to be money set aside for funding of different things, just kind of global things people are worried about, like migration and refugees, the arts, the humanities, renewable fuels? Like, are there thoughts of that, or are we just focused right now on what we can do to get the economy kickstarted again?
I think the answer is we're working on preserving and figuring out how we kickstart and we address it in a more broad fashion. So let me talk about kind of arts, the humanities, other organizations, nonprofits that don't typically fall into like the small business category, for example. So one of the things we did to make it easier and more accessible for nonprofits and other entities to get access to funds that they wouldn't normally have through the SBA was to expand the PPP program and the EIDL opportunities to nonprofits and to independent contractors, to others who don't typically meet the guidelines under the SBA for what it means to be a small business. And so by doing that, that's a way of infusing some resources and support there, and using those funds to help them keep their employees on, so that when we start to come back out of this, then there's a baseline for them to build from. So that's one way. I think that in many of these other categories, these are ongoing questions. We expanded known and existing programs, especially in areas like food assistance, the needs for families, to widen the net that makes the bar lower for them to get the access to support and resources. I think that I got this question the other day about refugee resettlement and migration, and I think that's a good and ongoing question that I think it's something that's going to have to continue to be wrestled with. Our budget around that had already taken a hit, and so I think that how that comes out is yet to be determined, and we're going to keep looking at all of those places. When we're thinking about when I think about it, all of the different kind of pieces to the economy, our energy sector is included on a broader basis, right? We already know that here, oil and gas and our producers and our companies here have taken a hit because the lower price of oil, and then the back and forth of the battle between Russia and Saudi Arabia. But we also have an amazing and robust and diverse group of businesses here in the state that are in wind and solar and other next generation technologies. Many of those companies will fall under the small business support category. So I think our approach was to spread the umbrella as wide as possible so that we were hopefully not missing smaller segments that gave people the opportunity to self-identify and to address it in that way. But I do know that there's ongoing conversation about what is needed and what we're going to have to address moving forward. So once we start to put these in place, like where are the holes that we've already begun to identify and then filling those. And one of the things that is really important for us is to hear from people in our communities what is working, what is not, as we get these things rolled out, because that's one of the most effective ways for us to really consider, did we do this right or do we need to adjust it? Because, you know, something can sound really good, we're putting it together, it's moving so fast that where we need to make corrections or fill holes, or what's getting where it needs to be and what's not, and where the further needs are, I think is one of the things, Sherry, that we'll continue to look at moving forward.
Great. This question comes to you from Laura Butler with the University of Central Oklahoma. She wants to thank you for your work on behalf of the district and the state. She says she has reviewed the CARES Act and appreciates higher education being included. Realizing the large fiscal impact for so many, UCO is looking at about an $8 million impact. This, coupled with the budget cuts to higher ed over the years, has a huge negative impact. Are there conversations occurring about access to low-cost capital for higher ed? And if so, what are you able to share?
Thank you for that question. And I really appreciate it. It's so important. Yes, there are conversations about how we address the significant needs that higher ed is, there you are, Laura, I was looking for you, is experiencing as a result of this. One of the other things that I didn't mention that we also included in the CARES Act is relief for student loan debt. Including 6 months pause on the requirement to make payments on federal student loans. I want to be clear, it's not private. Federal student loans is what we were able to get included, as well as a pause on the accrual of interest. There won't, until September 30th, there won't be any collections. There are a few other things that are falling under that category, and that will apply for current students as well as people that are already in the workforce paying back their student loans. And to answer the question about what form that would take in resources for higher ed, I don't know yet. There have been a lot of conversations. There is absolutely recognition amongst many members that this is something that we need to address, but I don't know that there has actually been kind of a coalescing around what that looks like, because there's a lot of back and forth and ongoing conversations, as you might imagine. So I would certainly appreciate, I mean, if you all have any ideas, any suggestions about what would work and what would be helpful, reaching out to me and my team. That's one of the most helpful things for us, is to understand what it means in real terms for you, what it means for students. You know, we've been talking to a lot of different people, and that will help us, I think, identify smart ways to address the ongoing impact, because, you know, you've had so many schools and universities have had to empty their dorms, and so people have had to find other places to live, and there are just so many follow-on effects. And of course, as you mentioned, the cuts to higher ed reimbursement and support for our state schools over the past decade and a half or so in the state have also put you all in a really tight position. So Laura, we're continuing our conversation with schools and community leaders. If you all have suggestions and things that you want to share with us, please do. That will be helpful as we craft this next package.
Thank you. Our next question is from Chad Bennett. He's the owner of Infinity Staffing, which is a temporary employment agency. And I think basically his question boils down to, do you know if there's going to be any relief or reimbursement for the unemployment percentages and the unemployment insurance increases that could possibly come back against employers.
Do you mean, I don't know, hopefully Chad's here. Can I ask for a clarification? Chad, do you mean that's okay, there's a lot here. Do you mean that if the unemployment numbers go up for companies, that their contributions to unemployment are also going to go up because of the emergency and the need to lay people off, not because business practices or other problems, but because they were laid off? They had to lay off employees as a result of this crisis. Is that what you mean? The employer responsibility portion? I don't know if you can unmute yourself, but if you can, please feel free.
I can't see him. I don't know if he's on video or not. Can you see him, Brittany?
He's not on video, but I see his name here in the middle. I just want to make sure I'm answering in the right way. Oh yes, basically yes. Well, the increase hurt us for, okay, got it. No worries, Chad. That's helpful. So I think that's something that we need to look at. But here's what I'll say in the interim: the expansion of unemployment benefits under the CARES Act was intended to be in response to this crisis. So it is in addition to supplementing the state unemployment, expanding the pool, and I do not believe that should result in penalties to you as an employer. But I'm going to ask Charlie if he knows, and if not, for sure, we will follow up regardless to find out what the actual answer is. But it was our intention to make this supplemental, not to put on you as an employer additional burdens, but to help people who had lost their jobs. And then, with the PPP loans, to create the opportunity of certain employers that had to lay people off because they're operating on a really thin margin in cash flow, and if you lose all your cash flow, how are you going to pay your employees? That infusion of cash that would not add to your business's debt would allow you to hire them back. So that was the intention. But Charlie, do you have clarification?
Can you hear me?
Yes.
Okay. That's actually one question that I have not heard yet or read on. So thank you, Chad, for raising that. I'll be interested in knowing that question, is the answer to that as well. I would think, Congresswoman Horn, that your thought on it's a supplemental and it should not be rolled back, or it will not then fall back on the employers is correct. But I'll do some digging and circle back so we can get an answer. Chad, thanks for raising that. That is not one I've heard yet.
Chad, I will tell you that I did hear from Robin Robertson, who's the director of the Oklahoma Employment Security Commission, that employers would not be penalized in their unemployment rates that they pay in during this crisis, anyone that's laid off during this crisis. So, and I know that she administers the federal money down into the state level as the director of the OESC. So I'm pretty sure that that's the case, and I will email you her contact information. Okay, so I think that you can see the chat box as well, Congresswoman, but it looks like our next question, you want to take that one?
So it looks like, Trevor, this is your question about the, thank you for joining us, shared work program in the unemployment process where employees with reduced hours and or pay are still employed but can apply for benefits to help bridge the income gap. I don't know why Oklahoma hasn't adopted this yet. It's something certainly we can follow up on. I do know that in the CARES Act and the provisions, expanded unemployment provisions that we included in the CARES Act, also when we expanded the pool, it required the state to take action to expand that to the part-time or gig workers. But I know that with this massive flood of unemployment claims, they've been overwhelmed, but I don't know the answer to why this has not been adopted yet, but we can certainly follow up. We've gotten a lot of calls about what this new program means, and we'd be happy to follow up with you to see what we find out. I'll ask and see if Candace or Charlie has any insight. I know they've been both working on this as well. Candace, do you know? Okay. Well, we'll follow up, Trevor, to find out what's going on there. I do know that we've been working as closely as we can, and they've been absolutely inundated. So things are changing on a day-by-day basis, and I don't know if they just haven't gotten there yet to get it implemented. As I mentioned, standing up these programs, it takes a little bit of time to do that. So we'll find out, and we'll circle back. And Sherry, if it works for you, we can get you. You all can reach out to us, or we can get you the information and the follow-up answers and connect with anybody that we have a takeaway to come back to.
That would be great. We would be happy to facilitate getting that out.
Great.
So I think the state legislators are being called back to the Capitol on Monday to do the official work to declare the revenue default. Do you have any thoughts on how this is going to impact the economy, for how long, and how do we get back to some sort of normal?
I think I would hesitate to guess the full extent and the length of time it's going to take. But what I will say is that that's why it's important. We know that our state and our municipal governments, county government, have a balanced requirement for balanced budget. We know that before this virus hit, the economy was good. It was healthy. So thankfully, we're starting off. We're not starting off, but before this pandemic hit, we had a strong economy. So it was a stronger base. Now this is just sweep the legs out from under many of us in a lot of different ways. And so the recovery is going to take time. It's going to take time because of the health impacts, because of the loss of jobs, because of the change in the way that we've had to interact with each other, the canceling of conventions, and on and on and on. There are just so many things that it's going to take a while to recover from. And I think getting confidence back is going to take a while. But part of that confidence is knowing that we, as policymakers, are doing everything we can to address the health and the safety of the public, so that when we begin to open back up, they can have confidence in their health and safety and their ability to go back out and start to shop again, or do all of the things that we were doing before. And I think only time will tell, because right now what we know, the unemployment numbers that we've seen today are really not a full indication of where we are. Just as sadly the testing numbers that we are seeing each day are actually an indication of where we were about a week ago, because of the time it takes to get the test processed and a number of other things. So I'd hesitate to guess the impact, but what I will say is I've been pleased by how quickly we've been able to respond. I think the response and the targeted approach to help support our communities from a number of places is going to help to ease that transition rather than make it worse. I think if we had done nothing, it would have been just devastating, and I can't imagine how hard it would be to recover. But by supporting our small businesses, by providing resources, by making sure that we're meeting these different needs, or doing the best we can to meet these different needs and continuing to follow up on it, I think that will help to soften the blow to some extent. But I also think that we have to be prepared for a long road and just continued adjustments as we move forward. And in that, I think we're going to have to continue to take a step forward and go, okay, is this working? All right, well, this seems to be working. And then what's next? So I think the revenue failure declaration is important. But I think it's going to be up to all of our elected officials at different levels to do what we each can to help address this issue as we move forward. And you know, I don't know what's going to come out of the special session. It's I was a little surprised. I know they have to declare a revenue failure, but they're still in session, although they haven't been there because of COVID-19. So we're all in a little bit of uncharted territory as well as we are in the Congress. You know, my whole office, we've been working, as I'm sure many of you have, remotely now for, it'll be almost 3 weeks. We transitioned to remote work, but we haven't slowed down at all, which has meant that we've had to make some adjustments about how we do things, but it's also given us the opportunity to be creative in the way that we connect and get resources. But in the business of Congress, we're also having to make adjustments. And I think the state legislature and the governor and the state elected officials will have to do the same. So I'd hesitate to guess a number or the length of time, but the more thoughtful, intentional, and strategic actions that we take now, it gives us the opportunity to avoid the worst potential outcome. And it's going to be a matter of trading some pain in the present for less pain in the future, I think.
Excellent. I don't see any other questions in the chat box, unless you do, if I'm not scrolling down far enough.
I don't, but if anybody else has a question, happy to answer any other questions that you might have. And please don't hesitate to reach out. Let us know what you need, what you're hearing, you know, about your business. We can also, like I mentioned, we have a webinar on Monday. We will probably do that again. We're going to continue. We're putting out resource guides as we get more guidance from the agencies to implement these programs. We can also, if you have a question specific to your business or organization, my team, Candace and others can help you work through that. We can help facilitate with federal agencies, and that's everybody from individuals to business owners and others in between. Right now, we're working with a large different variety of people, and I'm doing a daily questions with Kendra. We've got a lot of questions that are coming up, and we'll keep answering those questions. But if you want to reach out directly to our office, you can reach out at horn.house.gov, or you can reach out to Sherry. She knows how to get a hold of us, and we're happy to be here to help support, because this is one of those times that we truly remember what it means to come together for the good of the whole, and that we have to protect both our communities, our health, our families, and our economies, and that both of those things go hand in hand. And I'm sure many of you have heard me say this before. I'll keep saying it again. We don't have to choose between policies that are good for our pocketbooks and our economy and our opportunity, and policies that are good for people, because we've got to recognize how both of those go hand in hand. And it's a tough balance, and I'm not saying we're going to get it all perfect, but we're going to keep trying. And the more we hear from you all with questions or feedback or concerns, the better we're able to respond in real time, as much as we possibly can. And in the meantime, since we don't get to see you in person, it's good to see many of your faces on here. And I also will mention that we still have more the business of Congress to do. We've got to get appropriations done. We're working on the defense authorization bill. We're still doing all of that at the same time that we're dealing with this. It looks quite a bit different. So we're just kind of making these adjustments as we go along and doing our best to just see what works and what doesn't, and then make any adjustments moving forward.
I'm really glad to hear that. It seems like things at the state level have just really screeched to a halt at the Capitol. So it's good. They're really focused on the revenue and the budget, which is good. But unfortunately, some of the other great stuff has happened to go by the wayside for that.
Yeah. I think we're going to have to deal with some urgent and emergent issues that are going to get in the way of some progress that we might have been making or been able to make on some other important things, but whose level of urgency has fallen down the priorities list because of the need to address these urgent and emergent issues right now. It doesn't mean we're going to let go of them. I think the same thing is true in Congress, that some of the things that we were working on are just going to have to take a little bit longer in service to what we've got to do to take care of our communities right now and address this ongoing crisis.
Excellent. Well, I want to thank you so much for your time. You've always been available, and we really appreciate that. And it's great to be able to talk to you like this and to be able to see you. And now that you're out of quarantine, you can't really go anywhere. So
yeah, exactly. I mean, at least I know if I need to go to the grocery store, I don't have to have somebody else go to the grocery store for me and bring me groceries, set it outside the door, go get back in their car, and I open the door and get the groceries. It's been a little surreal, but I am very grateful for these video conferences because it's a good chance to see people's faces. And when when you've been home for several weeks, it's always nice to feel that at least kind of connection. It's not the same. And as Sherry, as somebody I love to be with people. It's just something I do, and I like to be together and to connect and hear stories, and it's a substitute. It doesn't quite take the place of a good hug when you haven't seen somebody in a while. So I just tell everybody to be prepared, because if I was a hugger before, you have no idea once we get on the other side of this.
Well, thank you so much for your time.
You.
Have a good afternoon.
Thanks. You too. Thank you, everybody. Thanks.
Bye-bye.
Bye-bye.